Everybody, and welcome back to the Weiner Wellness Week right here at the World of Wellness. With us this morning is Dr. Gideon Orbach. He is an incredible chiropractor and has been with the Weiner Wellness Center, World of Wellness, how long now?
14 years. Had my 14-year anniversary.
Years. Well, we are blessed to have you here for sure.
Thank
And today he's going to be talking about chiropractic, neurology, and rehab. This is part one. I'm sure he's going to come back with part two later in the week. But Dr. Orbach, I'll step down and let you get started.
All right. Well, thanks for that introduction, Tracy. So this is kind of cool. This is our first wellness week where we're downstairs making presentations. It's 9 o'clock on a Tuesday morning, so unfortunately there's not a big crowd, but I could be surrounded by people. So I'm not, but we still have the chat room on the side of the monitor. So if you want to join in, or if you want to participate in the conversation or the workshop, or if you have questions or you have comments or moral outrages, those are all, well, moral outrages aren't welcome, but the questions and the comments certainly are. My name is Gideon Orbach. I've been practicing chiropractic for, I just had my 20-year anniversary in practice. Hardly a lifetime, but certainly long enough that if you're paying attention, you can make some observations and learn a few things, and have seen some pretty neat stuff and know how to react when it comes back into your office in a different form. And of those 20 years, 14 years have been here at the Weiner Wellness Center. And first it was the Pain Release Clinic on the south side. Then it became the Weiner Wellness Center here in our Green Tree office. Now it's the World of Wellness. Same group, different name. We're up to the same stuff, but we keep growing and adding more to our bags of tricks. So this is just an exciting time to have our Wellness Week. And we have, I know it's been mentioned that we have deep discounts on the nutrients. I'm here. Dr. Phil is here. We're seeing patients. Everything's going well. Thank you so much for asking. So what I do is I practice neuromusculoskeletal chiropractic. And I sat down on the couch to catch the end of Jamie Dorley and Joe Messino's introduction and explanation of what was going on there today. And they talked about one of the instructors who I've taken a few classes with, but he's really one of my mentor's mentor. And that's Dr. Ted Carrick, who I believe should be considered the founder of the whole paradigm of chiropractic neurology. And that's one of the things I want to make sure that we talk about here today. So when I'm doing chiropractic treatments or just any kind of treatment in general with my patients, I'm borrowing a lot of the principles that I learned from Dr. Carrick and from his people. And we're taking a real sharp account as to what's the brain doing? How is the brain reacting to the environment that it's in? And what kind of techniques and maneuvers and principles and exercises can we use in order to influence the brain and enhance the neurological function and improve brain-body communication? So I get a lot of patients who've been to other chiropractors before. They tell me my this is out of place, my that is out of place. And we're not really taking that into account. And I don't want to disparage the way anybody else practices, but neuromusculoskeletal chiropractic with emphasis on neurology has nothing to do with putting people back in place and everything to do with how are we going to get your body and your brain to communicate with one another in optimal form. And when we're able to do that, patients are able to have increased ranges of motion, decreased pain, and generally they feel more comfortable living in their bodies as they have better balance, better coordination, better flexibility, better athleticism. So when you think about having better athleticism, better balance, better coordination, one of the things that should come to mind is this isn't just for people who are in pain. That most of my patients, they come to see me initially because pain brought them in. But as we progress through the treatment plan, as we have long-term maintenance care, as we see people for other issues, those other issues, my veteran seasoned patients, their other issues don't really have to do very much with pain so much as they want to recalibrate their bodies and the way their brains and their bodies talk to each other. And to me, that keeps the day exciting. It's not the same thing over and over again. It gives me a chance to actually listen to what people have to say about what's going on with them and to analyze what they're telling me and to figure out what kind of toll it's taking on their body and what we're going to do about it. So there's no set algorithm. There's no follow the yellow brick road, and we're going to do the exact same thing with each and every single patient. So I'm excited that I have a roster full of patients today, and each and every single one of them is going to present a unique challenge and afford me the opportunity to do some thinking about what's best for their individual status. Now, here's a shameless plug. I'm drinking the Nutritional Frontiers Lean Greens. Tastes like apple cinnamon, power pack with nutrients, and it's alkalizing and tastes good. So anyhow, this is Wellness Week. And if we're going to talk about wellness and what it means to be healthy, the first thing we have to do is come to some common ground and understand what it means to be healthy and assign the term a definition. So once upon a time, I'm standing in front of the room. The whole room is crowded with people. And this is the point where I say, hey, does anybody want to volunteer your definition of what it means to be healthy? And if you do, feel free to type it in the chat box. And if you just want to listen in and hear me roll with it, we're going to do that too. So to be healthy means that you have the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So when we talk about the external environment, that's everything around you. Those are the people that you're interacting with. Those are the other cars on the road. This is you recognizing that I'm going 70 miles an hour in the fast lane, and there's somebody behind me who's moving a lot faster because they're gaining on me. Should I hit the accelerator or should I move over and let them pass? Recognizing what's going on in the external environment and adapting to it and overcoming by acting in such a way that there's no bad news to come from the saga. What's our internal environment? Well, that's our body chemistry, our neurotransmitters, our nutrients, the way our brain is communicating with our organ systems, and what's going on inside of us. So if I always like to lean on the Kennywood example, and for those of you listening from far away and remote, Kennywood is an amusement park that has some of the best roller coasters you could possibly conceptualize. In fact, it's the place where the movie Adventureland was filmed, so it is famous. So if a whole bunch of us decide to go to Kennywood and ride the roller coasters, and some of us eat hot dogs in between roller coasters, and some of us don't, and the group of people who eat the hot dogs, some of them have an exercise in regurgitation, and they purge their hot dogs through the same entrance that it came into the body, it exits. If you don't know what I'm getting at, they throw up their hot dogs. And some people are going to eat those hot dogs and hold on to them, and we're going to have to ask the question, who was really sick? Whose internal environment kicked out all those toxins, and whose internal environment said, nah, we're going to hold on to these and let the nitrites and other parts wreak havoc later. So that's healthy internal environment in action, sort of self-cleansing, self-toxicity removing qualities. So once again, health is having the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. Okay, so far so good, Tracy. I see some notes up in the conversation chat, but I can't read them because they're small and I'm far away.
You're good. You're good.
Okay,
right
cool.
Now it's just a good morning. Okay.
All right. Well, good morning, and whoever's typing in, I appreciate the acknowledgement and the attention and you being here and being involved. So keep up the good work. The next term that we got to talk about is pain. Ultimately, pain is what drives people to seek out a chiropractor, a physical therapist, a massage therapist, the emergency. You get the picture. If somebody is in pain and they realize that this is the kind of pain that's acting as a warning, my hazard lights are lighting up and flashing, that neon sign is going crazy, I have to do something about this. You're going to seek out professional help. Now, I bring a certain bias to the table, but I think that professional help, you should see a chiropractor first. But we're going to discuss that more forever. But anyhow, so what is pain? Pain is an individual, emotional, subjective response to a noxious stimuli. Basically, pain is the mood that you're in. Now, I know a lot of people are going to be offended by that, but let me spell this out a little bit better and contextualize the definition. Pain is individual. What causes me pain, what causes you pain, what causes somebody else pain are three different things. We all know where we stand on a pain tolerance threshold. We have a good idea where some other people stand on that tolerance threshold. And I know that there are things that, look, you can do this to me and it doesn't bother me, but I know people that you do it to and they're going to fly off the handle and complain about how much it hurts. We all know that spectrum, so it's individual. Emotional, it has to deal with your reaction. When you're in severe pain, are you going to just bite your tongue and cruise through the day? Or are you going to react in such a way that everybody in your immediate surroundings knows exactly what's going on with you? And subjective means that it's yours. You are never wrong for how you react to pain. You are the international expert on your own circumstances. You are the only one who can say how much or how little pain you're in, how good or how bad you feel. Individual, emotional, subjective response to stimuli. Well, the stimuli, somebody stomped on my foot, somebody stomped on Phil's foot. Phil's wearing a pair of steel-tipped boots. He didn't even feel it. He doesn't know that it happened. Stomped on my foot. I'd have broken my toes. I broke my poor little toes. I need them. So that's how am I going to respond to the stimulus? So when the doctor or the chiropractor or the physical therapist or the ER staff or whomever tells you your pain is all in your head, where else would it be? So here's the $1 million question. What can we do to get inside of your head to help you better understand what you're going through, deal with it, adapt to it, and overcome that painful, noxious stimuli? So if you don't believe me, during the Civil War, there was very rudimentary surgery going on, battlefield surgery, and people would get shot in their legs, and there's the terrible threat of infection. There's very little that can be done with them. So soldiers were literally having their legs amputated, and then they were complaining about pain in a leg that no longer existed. So that's called reflex sympathetic dystrophy, also known as Sudeck's atrophy. It's this intense burning pain that we just can't simply understand. Well, how could you possibly have pain in a leg that doesn't exist? How can your shoulder hurt so badly when the only thing that happened was that somebody barely touched you? Those are the kind of painful experiences that lead us to better understand how neurologically phenomenon pain really is, and how important it is that if you're going to get rid of somebody's pain, or if you're going to help them get rid of their pain, what you really have to do are treatments that affect the way their brain is perceiving the information coming from their bodies, and change the way the bodies are delivering information to the brain. So with that in mind, what I do here when I'm one-on-one with patients is I do adjusting to the chiropractic style, adjusting to the spine and to the extremities. That means I treat feet, knees, elbows, shoulders. I do muscle release technique. I don't want to pretend to be as good a muscle therapist as Herman, Jacob, Adam, anybody else who's ever worked here or who will work here are. They're professional muscle release people, but I certainly do some muscle release with almost all of my patients. The other thing that I do is I teach low-tech exercises. Now, when I say low-tech, what that means is that your body is the equipment. As much as I'd like for everybody to go to Dick's and buy tension bands to attach underneath their and above their doors, and as much as I'd like you to get foam rollers and stretch devices and maybe get a gym membership, and I even promote a couple of personal trainers that I specifically like, in my world, when we talk about rehab, that's just simply not necessary. The most complicated pieces of equipment that I ask people to use are sometimes a golf ball, ice, a towel, and body positioning and body activities and exercises that you can do with only limited floor space. So that's what I mean by when I say low-tech rehab. So before we talk about more in detail about the technique that I use and why I use it, always the why, and what effect it has on brain-body communication. I believe this lecture is chiropractic, neurology, and rehab. So let's talk about a really important, we don't know if we want to call this a rehab exercise or a prehab exercise or just a general well-being exercise. And one of the places where it all has to start is we're going to talk about deep breathing. So what we're going to do is I'd like for everybody to sit up as straight as they possibly can. And if you think about the region of your body at the bottom of your chest to the top of your belt buckle, I don't know if you can see my belt buckle here. It's top of my belt buckle, bottom of my chest. I want to be as tall as possible in that region of my body. Now, as I'm sitting here giving my lecture, I'm kind of leaning into the table and making myself comfortable, but I'm not slumped into the table. I'm still, even though I'm leaning forward and putting my weight into the table, I'm still making myself tall and long in this section. But what we're going to do is we're going to sit up as straight as we possibly can. I'm going to throw my shoulders backwards. And as I throw my shoulders backwards, it's almost like they're jumping off a cliff behind me. And my shoulder blades, the wing bones in my back, I'm trying to point them down and actually touch my belt with them. Now, that's physically impossible, but I'm still pointing my shoulder blades and emphasizing it as down as possible, which in turn emphasizes my chest comes up and it makes it easier for me to be long in my abdomen. Then I want to think about a string coming down from the ceiling above, attaching to the top of my head, and just lifting up. So my head is up, my abdomen is long, my shoulders are back, my chest is up. And what I'm going to do is I'm going to take a moment to appreciate this. And I'm really actually very, very comfortable in this position because I've balanced my torso in such a way that it supports itself. And I'm not recruiting extraneous muscles to hold myself in positions that those muscles strain to keep me in. So now that we're here, I'm going to take a big deep breath in through my nose without losing this position. I'm going to feel my chest and my abdomen expanding outwards this way as I breathe in. So I'm sucking in that delicious oxygen through my nose. My torso and my abdomen are expanding. And I'm going to hold it for 1,001, 1,002, and I'm going to blow out through my mouth. And as I blow out through my mouth, I'm going to sink back to my normal good posture position without all the expansion. Let's do that again. Air in through the nose. We're becoming big, but we haven't lost our posture, and we certainly haven't shrugged our shoulders up. Our shoulders are still in that down, neutral, relaxed position. And we're holding, and we're holding, and we're going to hold some more and blow out through your mouths. One more time. Big deep breath in. Everything is expanding. We're going to hold, we're going to hold, and we're going to hold again and blow out through your mouths. All right, so how's everybody doing with that? Feel free to type your impressions or your observations or the sensations that you experienced into the chat box on the side. In the past, I've had people tell me that they felt lightheaded. That's a sign that they're just simply not used to breathing that deeply. I've had people tell me how relaxed they feel. That's a good feeling to have after this. I've had people feel like, wow, I feel so energized. I've had people comment about how supported their body felt in this posture that they're in as they're taking their deep breathing. And we're going to get way, way more into this posture later in the week. This is a shameless plug, but on Friday, I'm going to do a continuation of this talk, and we're going to talk also about workstations and building a home workstation and ways to be more ergonomic in your own place. And we're going to emphasize this posture position again. But anyhow, so important to get good deep breathing. And my suggestion is for anybody listening in is make this part of your daily habit, that you're going to find time to just stop what you're doing, take 3 to 5 deep breaths in a row. It should take you less than a minute, and then get back to the matter at hand. So what's this neuromusculoskeletal chiropractic all about? Let's say that I take a string of dental floss and I tie a knot in it and I put it between my bottom 2 front teeth right here. And somebody else sitting across from me grabs the other end of the dental floss and they give me a hard, sustained pull. So the bottom of my jaw, the bottom of my mouth is sliding forward, right? I have very powerful muscles. Well, just me. Everybody has really powerful muscles right here that are used for chewing. When you think about chewing your food or chewing gum, the muscles that open or that close your mouth shut and allow you to chomp that steak or chew your gum or bite into something hard, they get a lot of exercise all day long. They're powerful. They're dense. But they're not designed to pull the jaw backwards this way. We're going to start recruiting them to do something that they're not, it's not appropriate for them. So what happens is those small muscles, those temporalis muscle and the masseter muscle start to spasm and seize and develop the kinds of trigger points that our staff here is so adept at working out and getting rid of. And our jaw, as a consequence, loses range of motion. We're not able to open and close our jaws, our mouths as wide as we once were prior to the injury, of course. And it starts to hurt. And then other functions of that same muscle or that same muscle groups, namely chewing, become painful. So now we have pain, discomfort, we have inflammation buildup, we have trigger points. Our mouths aren't opening and closing the way they're supposed to, and it starts to hurt. So what are we going to do about it? Well, we have to fix this. So first of all, inflammation is a chemical process. We're going to solve chemical problems with chemistry. So I vote for some nutritional supplements. I like the anti-inflammatory blends like the X-Flame or the Inflame, depending on whether or not somebody's taking a blood thinning medication. I like turmeric. I like fish oil. I like ginger. These are all anti-inflammatories. And frankly, there are probably about 30 presentations this week. Most of them deal with supplements and product and combining products. I like to keep my world mechanical. So I'm going to let the nutritional experts talk about anti-inflammatory, and we're going to move on to the other things that we have to do here. Number two, we've got to restore the ranges of motion of the TMJ, of the hinge of the jaw. So we're going to get these small muscles to come out of spasm, and we're going to do some adjusting and some coaxing and some manipulation and some movement of that joint in order to get the jaw to open and close the way it's supposed to. Why is that so important? For a number of reasons. First of all, we want to have good range of motion at the hinge of the jaw so we can eat in the future. But there are receptor populations. Receptors are very specialized nervous tissue that receive information and transmit that information into the rest of the nervous system, the spinal cord, and the brain. And this is where the neurological chiropractor comes into play, where the receptors in the hinge of the jaw are what are called pressure-sensitive joint mechanoreceptors. And we have those pressure-sensitive joint mechanoreceptors not only in the hinge of the jaw, but in every joint in the body, even our fingers and toes. So when those receptors are allowed to fire the way they're supposed to, when a joint is capable of moving through its range of motion, they send information into the brain about where are we in space? What's our position? How are we balancing ourselves? How are we orienting our body to our environment so that we can adapt to and overcome our environment? Where are we able to localize ourselves? How are we able to move next? And when that happens, we start to produce natural endorphins and natural enkephalons, and we start to inhibit something called substance P, what we'll get into a little bit more of shortly, and we start to feel good. So when a joint doesn't move through its range of motion, we start to move tentatively and awkwardly and lose our range of motion, and the neurological phenomenon of pain starts to run away with itself. The third thing that has to happen is, in the whole dental floss saga, is the person sitting across from me has to quit pulling on the dental floss. If somebody pulled on that dental floss and yanked my chin and my mouth forward to create this whole downward spiral of events, and they're still pulling on the dental floss, what does it matter how many good nutrients I'm taking? And what does it matter what kind of treatment I've received to the hinge of my jaw? We're just going to keep doing the same thing over and over again. So please quit pulling on the dental floss. Now, the dental floss saga. Muscles, tendons, and the skeleton behave the exact same way. A muscle or a group of muscles will spasm. That means they're tightening and they're pulling in the wrong direction or in a disadvantageous direction. For example, the musculature of my forearm. If it tightens, I'm talking about below the crease of my elbow. These muscles start to tighten, they're spasming, and they're going to pull towards my elbow, towards my upper arm. And you're going to touch it, and it's going to feel like a brick wall. Those muscles travel down the length of my forearm, and you can even see on your own wrist, at a certain point, the musculature ends, and the tendon, a very thick band, begins. That tendon travels through into the palm, through the carpal tunnel region of the bones of the wrist, and attached to fingers, allowing me to curl and make a fist. So, how many people are typing, manipulating fine objects, driving all day long? We're doing things that are constantly curling our hands, our fingers into a fist. We are creating tightness in the muscles that exercise in that direction. In turn, that creates inflammation in the tendons. The tendons are like the dental floss in this scenario. And we start to develop hand and wrist pain. All of these people with hand and wrist pain are very, very likely suffering from a repetitive overuse injury where the musculature of the front side of the forearm has become tight and spasmed. It's created inflammation in the tendons. The tendons have reduced ranges of motion in the fingers and in the wrist. That reduced range of motion is sending information into the brain saying, we've lost ourselves. Where are we in space? We're not moving the way we're supposed to. We're not in concert with the rest of the body. Our rhythm is off. And in turn, the brain is interpreting that as, wow, this is severe pain. We have to go do something about it. Some of these people will go to see the medical route. They might be diagnosed with something like carpal tunnel surgery, and they'll have a surgical procedure that won't address the real problem. Some of those people will find their way into our office, and we're going to take the approach, we have to start to relax tight muscles, especially in the forearm. But let's look at the ancillary muscles that also help with these movements and support the arm in that position, in the shoulder and up by the neck. Let's figure out what's tight. Let's bring those muscles. Let's use technique to bring those muscles out of spasm. Let's use good nutritional supplementation to get rid of the related inflammation. And let's make adjustments, especially to increase ranges of motion in the wrist and in the finger. But let's not ignore the elbow, the shoulder, and the neck as well. So that's the very short version of what neuromusculoskeletal chiropractic is about. We want to look at people comprehensively, and we want to figure out how are we going to use the body as a tool, a system of switches and levers and handles that we can use to flip and to manipulate and to stretch in order to change the way the brain and the body are talking to each other. So let's take a very quick break and do another rehab exercise, and then we're going to move on. So I'd like to do this with our feet, but the camera is such that you're not going to be able to see my feet, so I'm going to use my hands to demonstrate. I want to take my right foot and I want to dig my heel into the ground so my toes are as high up as I can get them pointed towards the ceiling. And maybe that's only about this much for some people. Maybe it's that much for other people. And you're fine wherever you are. You can figure out, you'll know immediately what your own ranges of motion are and where your own limitations might be. And then with my left foot, I'm going to stand on my tiptoes so my heel is pointed up into the ground. Now here's the catch. Both of my hands or both of my feet are straight forward, pointing to 12 o'clock. So I'm in this position with my feet pointed at 12 o'clock, and now I'm going to switch. Opposite heel down, opposite toes up. Switch again, opposite heel, opposite toe, and switch again. Now, why is this so important? We have 28 bones in each foot. 26 of them are movable, 2 are fused. We have 206 bones in the human body. So that means a little bit more than a quarter of all of our bones in the whole body are in our feet. When you think about 26 movable bones, think about how many joints we have that are all richly populated with those pressure-sensitive joint mechanoreceptors. And the more we move our feet through a full range of motion, the proper ranges of motion that our feet are designed to move in, the more they're going to influence our brains as to where we are in space, the more we're going to start producing those natural endorphins and those natural enkephalons that will help to stimulate the production of natural endogenous opiates and inhibit substance P. When body tissue is destroyed, whether we talk about the tissue being the skin on your cheek, or whether we talk about the joints, the small joints and the distant ends of your fingers, or whether we're talking about severe muscle pulls or spasms, no matter what body tissue we're talking about, when it becomes destroyed or damaged, what happens is it releases something called substance P. Substance P is also a neurophenomenon that will influence the brain. And as substance P builds up and as it accumulates some more, the brain is going to interpret substance P as this is my reminder or my trigger or my mechanism that I should start feeling pain. This is why if you have mild pain in some parts of your body, a mild chronic case of pain in multiple body parts, and then you have an acute injury causing immediate pain between one new body part in the brain, all of those other body parts that had those chronic discomfort and low threshold pain, it starts to increase because your body is producing more substance P and the brain is trying to divvy out, well, what am I supposed to pay attention to? I was getting low-grade signal from everybody, and now I'm getting high-grade signal all over the place. And this is why we have flare-ups of chronic conditions whenever we have a new body tissue injury, new site. And this all works in part because of our autonomic nervous system. Our bodies, we can divide, what we can do is we can divide all the things that we do into both voluntary and non-voluntary activity. If I ask you to wave goodbye, you understand the language. That's something you can do if you so choose. If I say, will you please dilate your pupils? Now we have a problem. You have to have some sort of external stimulus, like a change in how bright or how dim the light might be around you in order to get your pupils to dilate. So it's not voluntary. The pupil dilation is reaction to environmental stimulus. So we're going to take those non-voluntary body chores and functions and activities, and we are going to call them our autonomics, and we're going to subdivide the autonomics into 2 categories. We have sympathetic and we have parasympathetic. Sympathetic is going to be like our fight or flight mechanism. When it's time to survive, or it's time to run away, or it's time to stand and fight and make a stand, our sympathetics are involved. When it's time to rest and digest and wine and dine, our parasympathetics are involved. So when you think about being on edge and having anxiety and your blood pressure going up and your blood being shunted to your extremities and your heart rate going up, That's sympathetic activity. Nothing is all good, nothing is all bad. We would certainly rather be parasympathetic dominant most of the time, but we don't want to discount the importance of our sympathetic nervous system. Same lean greens, shameless plug time. So when we think about our sympathetic nervous system, when it gets active, we want to dampen it down. We want to calm it down. And when we think about, well, what kind of mechanisms can we employ to do that? One of the best is deep breathing exercises. Why is that? Because the cerebellum, the area of the brain that is involved so heavily in coordinated activity, in balance, fires to inhibit or to slow down the sympathetic nervous system. So we're doing balance exercises. We're stimulating the cerebellum with very specific types of chiropractic adjustments. I told you at the very beginning, one of the things that we're looking for with neurological-based chiropractic is for people to feel better balanced, better coordinated, better deep breathers, more comfortable living in their bodies, feeling like their bodies are a one single unit and not a collection of parts just traveling through space together and moving at their own rhythm and their own rate. That's all cerebellum activity. And the chiropractic adjustments that the neurological paradigm uses, we're stimulating the cerebellum. The cerebellum is also the part of the brain that is the most susceptible to oxygen deficit. So if we're not getting enough oxygen into our bodies, we're not going to drive our cerebellum the way we should, and we're going to lose this great tool that will help us to inhibit or slow down our sympathetic nervous system, thereby driving our wine and dine, relax and digest parasympathetic nervous system. So far, so good. I think I see something in the chat box, and I know what I just went over was a little complex.
No,
Dr.
you're good.
Tracy, we okay? We're good?
All good.
Okay, so I can keep rolling. So what we want to do is we want to use chiropractic adjusting and deep breathing exercises as a tool to drive the cerebellum, to inhibit the sympathetic nervous system, and allow the parasympathetic nervous system to flourish. So the way our bodies are wired neurologically is that nerves are contiguous with one another, not continuous. That means that there are these tiny little gap junctions throughout the whole nervous system in the body, and little neurological messages jump and bounce from one nerve to the next in sequence. And the way they move, the way those messages move, is based on the diameter of the nerve. So two nerves of the same diameter will be able to transmit one set of information to each other quite easily, but we have a difficult time with what's called neurological crosstalk, that it's very unlikely that a nerve will bounce from one type of fiber to another type of fiber based on the diameter of the nerve, with one very notable exception, which is called an ephapse. A synapse is where two nerves come together, and an ephapse is an artificial synapse. Two nerves that don't belong talking to each other end up talking to each other. And that occurs, everything has a name. So we have what are called C fibers. C refers to the diameter of the particular nerve fiber that we're talking about. And when we talked about that substance P, and we talked about that tissue destruction, and we talk about the signaling that comes to the brain that says, hey, we should be in pain now. This is a problem. And then the brain starts letting the pain run away with itself. Those messages travel along a C fiber. It doesn't matter if it's coming from your toes, from your pelvis, from your ears, either way, we're talking about C fibers. Now, the sympathetic nervous system fibers through your body, your fight or flight fibers, are all the same diameter of the C fibers. That means that when you're in a sympathetic nervous system wound up, fight or flight state, and all of those sympathetic nervous system fibers are activated and ready to, if not already, carrying messages back and forth from the brain, those C fibers that conduct tissue destruction are able to form a synapse or an ephapse, an artificial synapse, creating neurological crosstalk between pain fibers and the sympathetic nervous system. So when you enter into this fight or flight state and you're wound up and your heart is going off at a rate that's too high for what you're used to, and your blood pressure starts to go up, basically you're turning your body into a very hospitable environment to experience aches and pains and discomfort. So another big principle of the neurological chiropractic paradigm is, what are we going to do to stimulate the cerebellum? And what are we going to do to use that cerebellum as a tool to inhibit the sympathetic nervous system? Now, we talked about those pressure sensitive joint mechanoreceptors and getting them to fire by chiropractically adjusting joints through their full ranges of motion and even beyond the ranges of motion that people are able to achieve on their own. Look, this is as far as I can point my finger. No matter how badly I want to, no matter how badly I hope, no matter what I think, my finger's just not moving any further than that. I can't extend it backwards. But if I take a force from my other hand and bend it, look, I have a lot of degrees of motion left that I might not be able to achieve on my own, but with a little bit of help with some chiropractic manipulation and adjusting, I've really increased the ranges of motion of that index finger, extending it backwards, doing what? Sending messages into my brain via the pressure-sensitive joint mechanoreceptors that live in that finger, telling my brain, look, here we are in space. I should be able to move much better. What else are we doing from a clinical perspective? We're going to work on our deep breathing. Once again, all of that delicious oxygen is essential to feed the cerebellum, the part of the brain that's most susceptible to oxygen deficit. So let's review that again. Once again, long in the torso, shoulders come all the way back, head is up like it's suspended from a string, my chest is up because my shoulders are back. I'm going to inhale through my nose, take a long, slow, deep breath, and I'm going to hold it for 1,001, 1,002, and blow out through my mouth. And we're going to do two more. One, big deep breath in through your mouth, everything in through your nose. Everything is expanding, torso is getting big, shoulders are slipping back, chest is coming up, shoulders are not shrugging up, they're falling back. Holding 1,001, 1,002, and blow out through your mouths. I'm still long in my torso. One more time, big deep breath in through your nose. We're holding some more, holding again, and blow out through your mouths. Now, we just took 3 deep breaths together. We did 5 earlier in the presentation. I'm only allotted an hour for this speaking time, and in this hour, we've already done 3 to 5 deep breaths twice, and we haven't really missed a beat from what we're talking about and what we should be doing and our daily routines. So I'm optimistic that everybody who's listening in, everybody who's paying attention to me, will find those a minute here, a minute there, and 2 minutes somewhere else, 5 or even 10 times a day to work on those deep breathing exercises and skills. We want to talk about coordination. Once again, there are 28 bones in each foot, 26 of them are movable. All of those movable joints have pressure-sensitive mechanoreceptors richly populating them, and we talked about that full range of motion, keeping your feet at 12 o'clock in order to get them to do what they're supposed to do in terms of reinforcing the way feet move, getting those receptor pools to begin to fire or to continue to fire and send all that information into your brain about where we are in space. So that's really how we're going to use the body as a tool in order to influence the brain and change not only the messages that the body is sending the brain, but also how the brain is receiving those messages. And that, my friends, is the brief story of neuromusculoskeletal chiropractic. My patients have ranged in age from most recently, I treated somebody who was 3 months old. I've treated people who are younger, but that's my most recent ultra young person. Also, fairly recently, I've treated not my personal record, but in recent memory, like within the last 2 years, I treated somebody who was 96 years young. So the age range between 3 months and 96 is, well, that's a lifetime right there. Of course, most of my patients come to see me initially because they have pain or they have some sort of symptomatology that it just won't go away on its own, and they're starting to develop some anxiety about it and want to do something to prevent this from going from bad to worse. And through the course of treatment, we're doing a lot of question and answering. We're doing a lot of interview and documenting how people are feeling and what their experience is with their whole biopsychosocial experience, not just how much pain are you in. And we're finding that these people are like, I used to walk up the steps taking one step at a time, and now I feel like sometimes, all the time, most of the time, I can step up with my right foot on one step, and then with my left foot I can step up on the step on top of it and the step on top of that, and I just feel more stable. And some people will say that as I walk along, I don't find myself looking at the ground, staring at the ground right in front of me, because I'm afraid I might trip and I want to see where I'm stepping, but I'm looking up and I'm watching the road ahead of me, because I can take this big scanning view of everything without having this focal, I see right here, there's no crack, it's safe to step. And so these are the things that are exciting, that people have become, regardless of what their background might be, or their age, or their demographic, that they're become a little bit more athletic, a little bit more coordinated, and a lot more comfortable living in their bodies. And that's what we do here. So anyhow, at this point, I don't see any more stuff in the margins. Make sure that we leave a couple of moments that if there are any questions, comments, or even moral outrages, this is the right time.
You never have any moral outrages. You're too well loved.
Well, I appreciate you saying that, but there's room. I'm not a hater. If you got a problem, let's hug it out.
Hash it out. Let's hug it out. That's right.
So,
well, thank you, Dr. Orbach.
Okay. All right. Well, I want to thank everybody who's listening for the kind attention. I want to thank Phil over here, who's like in the DJ booth practically, with so many computer monitors up in front of him, we can barely even see him. And he just looks like he knows what he's doing. And so far, everything's worked out fine. So that worked. And of course, I want to thank you, Dr. Tracy, and hosting and moderating and making sure this all goes smoothly. And we really don't take enough time to acknowledge the people behind the front desk here. They take a lot of undeserved abuse. Sonia, Ariana, sometimes Heidi, sometimes Candace, sometimes Phil. Everybody takes their frustrations out on them, including me sometimes. So we got to acknowledge those people who don't get enough credit. The people who are stocking shelves in the back, Monica and Mike, and sometimes Brady is here, and who else is here sometimes? Nutritional Frontier staff occasionally comes to help us out with our sales. So, we talk about, Joe Messina refers to me as the anchor of this place. I've certainly been here the longest, at least amongst the people that you see up front. But there are a lot of people who just don't get the credit that they deserve. And this is a good time to make sure that they're at the very least acknowledged.
Absolutely.
So, anyhow,
thank you for doing that.
Thank you all so much. One more shameless plug for me on Friday morning. I'm going to be prior to when we were the Weiner Wellness Center. I had 3 lectures during the sales, and I helped with some of the roundtable discussions. And when we became the World of Wellness, and we have a new management team, and these people are connected, like Dr. Tracy and Jamie, like they know people. So we have people who have national and international platforms. We have Judy Mikovits. We have Robert Scott Bell making presentation. Those guys are people who I want to pull up a chair and listen to. So now my lecture times are reduced, which is fine. I'm not whining about that. But on Friday, I'm going to try and combine 2 lectures into one, and we're going to talk a little bit about some more things that you can do for yourself. And we're going to talk about the ergonomics of workstations. And of course, we're going to rehash some deep breathing and posture. So shameless plug for me on Friday morning. I'm talking at 11, and shameless plug for the lean greens that keep you going.
They do. Well, we love to have you lecture, but we know you're also busy with patients, and that's really where, your heart is. And please
sure.
come see Dr. Orbach at the World of Wellness. He is amazing at what he does, and always. So thank you for being here this morning. Thank you for attending the lecture. We have Dana up next. Joe Messino's daughter is going to be talking about essential oils. We are excited. So thank you so much, Dr. Orbach, and everybody for attending. Stay tuned for more education right here at the World of Wellness.